Okay, I have checked the medical order and the dressing change has been ordered for this patient. So now I'm going to enter my patient's room. Hi, Mr. Jones. My name is Lainey. I'll be your nurse this evening. Would you mind telling me your name and birth date? Okay, thank you. So today we are going to be doing a dressing change. I gave you pain medication about an hour ago. How has that kicked in? Are you feeling okay? Are you comfortable? Okay, he says he's ready. Dressing changes can be kind of distressing sometimes for patients, so it's important to assess their comfort level. So here I'm going to drape my patient so I can expose the wound, but here I want to make sure that gowns and blankets are out of the way so I can complete this procedure sterilely. So this is a sterile procedure. First I'm going to clean the wound, and then I'm going to begin a sterile procedure when I open this package. I do not require assistance. Please be careful not to touch your wound or any of my supplies so we can keep you safe, alright? Okay, so I also want to inform my patient, so I've told him that it's a sterile procedure, and I also want to tell him that if he sees any bleeding or is experiencing extreme pain after I do the dressing change to let me know. So sir, if you bleed through this bandage, please let me or another staff member know and we will take care of it for you, okay? Alright, so I've performed hand hygiene and I'm going to put on a set of clean gloves. I've gathered my supplies. Here I have some cotton swabs and a measuring tape. Oh gosh. I have some cotton swabs, a measuring tape, and a dressing change kit. And I also have a trash can at my side. So I am not going to take the red bag out of my kit. Alright, sir, so I am going to hold down the uninjured skin and peel the tape back away from my patient's wound. And I'm going to keep this out of his line of vision. I don't want my patient seeing the soiled dressings. Alright, so here I see I am looking at the color and the amount of drainage that is present, and I'm going to remember that so I can document it later. Yes, and now I'm going to inspect the wound. What I'm looking for here is redness or rigidity or anything that looks abnormal about the wound. I'm also going to palpate it now. Here I am checking for any oozing or grimace or a change in my patient's pain level. And then I'm going to educate my patient about the wound's appearance. It looks like it's healing well. Let's measure it. But so far it looks really good, Mr. Jones. It looks like you're healing up really nicely. So I'm going to take my cotton swabs. I'm going to check each side for tunneling. I'm just going to lightly run my swab around the edges. Okay, no tunneling is present. That's great. Now I'm going to measure my patient's wound. Okay. It appears to be 14 centimeters long. About 2.5 centimeters, well, 3 centimeters long at the widest point. Oh, and the depth is about the same, about 3 centimeters. Okay. Alright, so yeah, so it does look like it's healing well. Okay, now I'm going to perform hand hygiene again. And now I'm going to open up my sterile tray. So I'm going to observe sterile procedure when I open this, because now I'm going to begin cleaning my patient's wound. So make sure that this is to the side. All right. Hand hygiene. Alright, sir, so now begins the sterile procedure. Again, please do not touch your wound or any of my supplies, okay? This is to keep you safe. So now I'm going to take out my sterile gloves. I'm going to be really careful here not to touch the outside of my gloves. Okay. All right, perfect. So now I'm just going to dispose of that and lay out my sterile field. So the outside of this is not sterile, so there we go. Okay, so I'm going to observe 1-inch borders. I don't want anything touching my actual sterile field. Here I'm going to lay out my supplies. Just want to be careful not to touch the outside of my kit because it is not sterile. I'm going to dispose of these because I won't be using them. Alright. So now I'm going to begin cleaning my patient's wound with the prescribed solution. And I'm keeping my hands in front of me and in my view as well as my sterile field. Okay, so now I'm going to clean my patient's wound from least contaminated area to most contaminated area with the prescribed solution, and I'm going to use a different gauze with each cleaning stroke. Being careful not to touch myself or my patient's gown or bed sheets or anything else that is not sterile. Alright. Okay, so my patient's wound is clean. Now I want to wet some of the gauze to put inside of my patient's wound. And with this, I want to be really careful not to touch the edges of the wound that are not clean so I can keep this gauze sterile. And I'm going to wring out any excess fluid. And I don't want my hands to touch the edge of the wound either. I want there to be enough gauze that it's packed tightly so that my patient's wound remains protected. Okay. Alright, looks good. Now I'm going to put dry gauze over the top. Alright, now if I had any, I would apply some skin protectant, a skin barrier. And now I'm going to put the ABD bandage over the top and tape it down so it is secure. All right, Mr. Jones, just remember to please remind me please let me know if your patient, oh my gosh, I'm tripping on my words. Please let me know if you begin bleeding through this bandage, or if you need assistance in any way. If you're uncomfortable, please let me know, and I will take care of you. All right. So now I've completed securing the bandage. So I'm going to remove my sterile gloves, perform hand hygiene, and I'm just grabbing a pen to initial and date my patient's bandage. Okay. And I'm just going to assist him into a comfortable position and assess his comfort level again. All right, sir, how are you feeling? Okay, that wasn't too bad. All right, well, you do have some prescribed pain medication that I can give you again at 8 o'clock. So if you need it any sooner, or if you are experiencing any other pain, or if you bleed through, please let me know, okay? So I'm assisting my patient back into a comfortable position. He has his call light and water, and I didn't see any tunneling or anything abnormal with his wound, but I'm going to document the amount of drainage and the color and odor and anything else I noticed about the wound, like the integrity or the redness of it, and I will do that right now. Thank you.